Good evening, I'm Pinky Webb. Tonight we ask the questions, we tackle the issues, we clarify matters, and we get on point. Senate Senior Deputy Majority Leader JV Ejercito has his hands full with a host of issues that need immediate attention from lawmakers and the government as a whole. Among them, amendments to the Universal Healthcare Law, which he authored, that would expand PhilHealth coverage, lower its premium, and prevent fund transfers. The senator is also pushing for the return of some 10 billion pesos slashed from the 2025 budget of the Defense Department, which would affect the armed forces' efforts to modernize. And his campaign for a comprehensive infrastructure development master plan that would prevent flooding in Metro Manila, as well as adequate funding for key railway projects across the country. Let's get on point with Senator JV Ejercito. Good evening, Senator. Welcome to the show.
Yes,
good to
evening,
have
Pinky.
you.
Nice to be back with you.
Yeah, first time dito sa
Yes.
Bilyonaryo News
Yes.
Channel. I'm going to go back to, of course, the ruling of the Supreme Court issuing a temporary restraining order. Doon po dun sa natirang 29.9 billion sana na ita-transfer from PhilHealth to the national government. Your quick reaction to that, sir?
Well, being the principal sponsor and author of the Universal Healthcare Act, of course, I'm relieved, no, because my position is that the funds of PhilHealth should remain for PhilHealth, its members and its beneficiaries, and for health purposes. But there was the GAA last year, or the General Appropriations Act, there was a provision that allowed the finance department or the economic managers to tap excess funds from GOCCs. No? So pinasa rin po yun eh. Since the GAA is considered a law, so they can tap excess or savings. So, cut the long story short, PhilHealth declared that there's an 89 billion peso excess or savings for 2020, 2024 that will be used for other priority projects. No? In fact, 29 billion na lang inaiwan, no? Because it will be used to fund other priority programs of the government.
Yeah.
But Pinky, again, let's go back to the intent of the law.
But before you do that, I was a little, while I understand you are the author at matagal mo nang pinaglalaban po yung Universal Healthcare, ano po. I remember nung bago kayong senador and then you lost, di ba?
Yes,
Pagkatapos masama nga yung loob mo kasi hindi mo napagpatuloy sana yung intent nitong Universal Healthcare law. In other words, do a follow through. And then now you're back, which is exactly what you're doing. But when I was looking back at some of the interviews, you were saying that it shouldn't be transferred. However, you were also saying that you understood why it was going to be transferred. So it felt like to me, you were against it, but hindi mo siya masyadong pinaglaban. Am I correct, sir?
No. I said that hindi natin masisi yung government, yung economic managers at the time, because it was, I think it was PhilHealth's fault because they shouldn't have declared a savings in the first place. No? First of all, I go back to the intent of the law. It's giving access to access to good healthcare without the financial burden for all Filipinos, no? Meaning, Pinky, that all Filipinos are now considered as member of PhilHealth. If ever they get hospitalized, need medical attention, PhilHealth should be there to assist, no? So giving access to good quality healthcare without the financial burden. They shouldn't have declared an 89 billion excess or savings while a lot of people, a lot of patients, you know, are still having a hard time, difficulty paying their medical bills. As you know, that's one of the burdens of every Filipino family is paying the medical bills, no? Medical expenses, from hospital bills, doctors, medicines. Checkups. Because, you know, Pinky, going back to my experience as a local government chief executive, as a mayor, I know for a fact that it is one of the biggest burdens, no, that each family really carries, no. Sometimes you're an OFW, you have 4 or 5 million pesos in savings, no, after working so hard.
Yeah.
One
Mauubos
member
na
of
lang
the
bigla.
family will have cancer, will have
Will have to go-
dialysis or heart
yeah.
attack.
Yeah.
In just one glance, it will drain all the savings. So that's why when I got the chance or opportunity to be in the Senate, I know it's an ambitious measure, no doubt. You know, ensuring everybody have universal healthcare. We're not a rich country, yes, but I saw to it that there will be adequate funding.
But
for
when
it.
you say universal health care, you said the intent is to have access to, this
Good
is
quality
important,
healthcare,
good
yes.
quality healthcare. Good, importante po yun.
Yes.
Quality is also important. And then, without the financial burden.
Yes.
Do you think this is being achieved? Number one, is there good quality healthcare that is not financially a burden to the people?
Well, actually, Pinky, there's big improvement, I would say. The government hospitals now, to the health facilities enhancement program also of the UHC, under UHC, they have improved already the facilities. In fact, if you visit some of the hospital facilities, especially the tertiary hospitals, you wouldn't think you're in the public hospitals. Gone are the days na yung
You mean
dark
private?
hospitals, dark, overcrowding. A lot have considerable improvement. In fact, we are already on the second phase already of establishing specialty centers, no? Lung, kidney, heart, and the cancer centers it's a work in progress, but we are improving, no? Just to also inform everybody, the Universal Healthcare Act is a 10-year program. No?
And you are on
it's
your
a work in progress.
5th year?
Entering 5th year.
Okay.
One of the reasons that I really wanted to get back Pinky is, we were in one of our interviews that I felt bad when I lost.
Yeah.
Because we just passed the UHC and the Department of Human Settlements at the time, 2019. Passage is half of it, and the other half is a real implementation.
Correct.
No,
Correct.
it's different if the sponsor or the author is there, because you will really focus and
right.
take care of
and
it.
now
That's
that
your
you're there,
baby.
which is a good thing.
Yes.
So I want to go back to that. Good
Yes.
quality healthcare without the financial burden.
Yes.
There's still a lot of people, sir, that are burdened financially by
yes.
all their medical needs. One example, I'll go straight to the point. I'll get on point with this. I was recently hospitalized, and PhilHealth paid 2.5% of my hospital bill. So I can imagine that has happened to me, yung mga kasama po natin dito, mga kilala natin, mga kapamilya natin, yung mga kasama din natin sa bahay na namomroblema. Here's the thing, sir. When I was there, kinausap ko po yung PhilHealth / yung taga-ospital, hindi ko na po sasabihin sa ospital, tinanong ko, bakit ganito kababa? Inalam ko na, sabi nila kasi yan lang daw yung case rate. So sinabi ko, saan ko ba makikita yung case rate? Kasi bakit naman napakababa? My bill, PhilHealth covered 2.5%. And then I said, saan ba yung pinakamataas na, or saan ba, sabi ko ganito, sabi natin dengue. Magkaroon ng dengue ang isang tao. Pag pumunta ata sa public hospital, my understanding is libre. Pero pag pumunta ka sa private hospital, do you know how much, sir, I was told that PhilHealth will be paying? Make a guess, sir. 9,000 pesos. Alam naman po natin pag dengue, umaabot yan ng halos 5 o 7 days. And ang babayaran lang po sa private hospital, I was told, was 9,000 pesos. Is that fair? Is that right?
That's not
Is
fair
that
at
good quality healthcare without the
That's-
financial burden?
No, that's not fair at all. That was not the intent of the. That's why probably if during the recent budget hearings, I really almost lost my cool.
What happened?
During the interpellations, no, I asking the president of PhilHealth, CEO Mandy Ledesma, what happened? No, they were a failure in the implementation of the universal healthcare law because the PhilHealth is the primary agency that is tasked to implement. Unfortunately, we only have one national health insurance, no, and that is PhilHealth. I told him, what's your orientation? Ano bang tingin niyo sa sarili niyo? Private corporation? Are you a private insurance company that it tries to veer away from the liabilities? At the end of the year, you're proud of your savings or profit.
Kumikita.
Yes.
Oo.
That
Okay.
is not our orientation. If you're in government service, whatever funds for public service, dapat inuubos yan. Why will you be proud of having an 89 billion peso savings or surplus ng ngayon, tinatap tuloy, when a lot of people are having difficulties in paying their medical bills?
Please tell me how he
Nagpupunta
responded
sila
to
kung
that.
saan-saan.
Opo. And what was his response to
he
that?
said that when he assumed, he immediately adjusted the case rates, everything. But sabi ko, I've been quiet since I got back to the Senate. For 2 years, I gave chance to the new administration, for your administration to, to improve everything. But it's already 2 years and people are still having a hard time. I showed copies of medical bills that go to my office.
Nanghihingi po ng tulong.
Asking for assistance. For example, 500,000 yung bill, sasagutin ng PhilHealth, 12,000 pesos. 100,000 na bill, sasagutin ng PhilHealth, 4,000 pesos. Sabi ko, nasa ng PhilHealth?
And tell
That
me,
is
sir,
not our
ano
intent
po ang sagot niya
at all.
doon?
Sabi niya, yun nga po, because of the case trace. Sabi ko, we are already entering the 5th year. You should have adjusted that long before.
And who decides the case rate, sir?
Well, it's PhilHealth. There's a Health Technology Assessment Council.
The
HTAC, composed of experts. They should be the one recommending the benefit packages where the case rates would be based. So, 4 to 5 years, there is really a disconnect. No, it's PhilHealth, probably HTAC to some extent, DOH. Why didn't you perform as expected? By now, on the 4th year of implementation, it should already be felt already by the people.
Does the universal healthcare law say at any point that kung ano man ang iyong gagastusin sa ospital, ay dapat ang PhilHealth bayaran ng a certain percent?
Yes.
I'm trying to simplify it. I'm
Yes.
sure it's more complicated
Yes,
than
just
that.
to give you an example, Pinky, yung benefit packages also leveled up. No? For example, breast cancer, at least 150 to 200,000 pesos. For severe pneumonia, from 300,000 to 500,000. Pag kidney transplant, 600,000 pesos. Open heart surgery, angioplasty, bypass, I think 500,000 supposedly yung benefit package from PhilHealth. But sabi ko nga...
Sorry to interrupt you.
Yes.
Does that matter if you are in a public vis-a-vis a private hospital, sir?
That doesn't matter
Doesn't
because
matter.
that's already part of the benefit packages.
Okay, so it doesn't
by law.
matter. Okay.
Yes. I don't know why they keep on saying that it's the case rates. They should have adjusted. We are already, as I mentioned, going on the 5th year. They should have adjusted it early on. And first of all, yung UHCR intent is for people not to go to line up to PCSO, to PAGCOR, to politicians, no? Kay governor, kay mayor, kay congressman,
I'm
senator.
with you there, sir.
We want to remove the patronage politics.
And
no?
more than that, I think kaawa-awa naman po yung kapamilya
Yes.
na kailangan pang luminya at umapila at humingi
Ngayong
ng
hirap
tulong.
na sila, no?
At habang
Yes.
nandun yung kanilang
Yes.
mahal sa buhay, nasa ospital, dahil hindi po sapat yung kanilang pera. You're right, sir.
Yes.
I agree with you completely. Tanggalin din yung patronage
Yeah.
politics. And of course, yung hirap
Yes.
at yung stress na nararamdaman ng pamilya.
I really understand this because when I was mayor, I go to the barangays. It's really one of the biggest burdens of the family. Nakakaawa talaga when you go to the family. If someone has cancer, going to dialysis, no? You can see how hard it is for them. They sell sa probinsya, kalabaw, traktora, here cars, tablets, cell phone just to pay their bills. And that's why I really push for this. And it was well funded, no? Ambitious yan. But yung direct contributors, these are the employees like us, no? Yung regular employees, we contribute. So, but under the universal healthcare law, all Filipinos, meaning everybody, even the indigents, yung may hirap, senior citizens, and PWDs.
Yeah.
No,
So bakit
who
po
do
pag
not
nasa
have the
ospital,
cover.
tinatanong pa kung may PhilHealth ka? If you're saying that every Filipino is supposed to be part of it already.
Supposedly, everybody is now considered as automatically
Let me
considered
clarify
as
that,
member.
sir. Is it
Yes.
supposed to be, or are we all part of PhilHealth
All are
already?
members. Everybody. Even the
that
family
is a
members.
fact.
That is a fact.
So that when you go to
That
a
is the law.
hospital, hindi
Yes.
po nila pwedeng sabihin na wala kang PhilHealth number.
Hindi na pwede yun eh. Yun nga, minsan di ko na alam kung nagpapalusot ang PhilHealth. They want everybody to register first because all Filipinos are now considered as members. Number one, yung consulta package. There's free annual checkup for everybody. Yung benefit packages, not all Filipinos know about these things. Are they doing this on purpose so that nobody would try to get the benefit para makatipid sila?
Senator,
no?
let's talk
That's
about
one.
that because we did talk about that consulta package, which we did not know about during our interview with Dr. Mingita Padilla. And we got a lot of comments from those who watched it and said they didn't even know about it. We're going to talk about that after the break. This is On Point. Stay tuned. Welcome back. You're watching On Point. Still with us, Senator JV Ejercito. We were talking about that consulta package. Please tell us more about that. Parte po yan ng UHC?
Yeah. One of the features of the Universal Healthcare Act is to strengthen the preventive side, no? Because kasi pag curative na, mahal na yan eh. Pag na-hospital na, pag lumala na yung sakit, it will be more costly for the patient, for the family, and even for government. So that's why we want to strengthen the preventive side, no, by improving the health centers, yung mga health facilities, no, para meron tayong first aid, yung primary care. Consulta package, that means that annual checkups being key, it includes blood tests, should be free, no, for every year, for every Filipino, no. Again, let me be straight that under the UHC, all Filipinos are considered as members already. Na even yung I mentioned earlier, yung mga PWDs, indigents, those who doesn't have the capacity to pay are considered members. Sasabihin ng bakit not sasagutin sila? Either we are paying. We found a source of funding for them, yung po mga sin taxes, no? Alcohol, tobacco, sugar drinks. All of the income for that all the revenue will be used for the indirect contributors or itong mga
Yung mga hindi nagko-contribute.
Hindi kaya, yes. Even the PAG-course and the PCSO social fund, dati may social fund yan, will now be part of the Universal Healthcare Fund.
Okay, so we're all members. We're all
Yes.
PhilHealth members, and we are entitled to a consulta package.
Yes.
Some of the people who had watched that interview said that they went to the PhilHealth website, supposedly, and they clicked on it, and it led them nowhere. So I don't think, kasi, sir, it becomes, and it's not to blame you, that we inform people, and even ourselves, that there is such a package that exists, yet we have not been given enough information about it, or we can't seem to find it.
That is that's failure of government because even our OFWs are complaining during the pandemic, no, when PhilHealth increased its premium contribution. Sabi, ba't kami magbabayad dyan? Hindi na nga kami nakikinabang. Magnabayad pa kami. What they don't know, because of lack of information, that all of their family members are now considered members na. Dati, kung may magkasakit, magpapadala pa sila. Our intent is even for OFWs, even if they're working abroad, if one member of their family gets sick, PhilHealth should be there already, no, to assist or to be of assistance to every member of the family.
And because you're the author of the Universal Healthcare Law, if you were to have this 89.9 billion, and before I go there, sir, has it been categorized as excess? Is it called savings? What is it?
They called it excess funds. So,
Excess, okay.
Or savings. No? That's
So to them, it's the same thing.
It's the same thing. So because of the provision in the last year's GAA, now the government can tap that fund for other priority
Which
programs.
is also questionable. It's being questioned before
it's been questioned
the
already.
Supreme Court. They said
And
that.
likewise, that's why I said that, governments has priority programs that need funding. You cannot fault them for looking for funds that are excess. No?
Yeah.
So it was PhilHealth's fault for declaring excess funds where in fact a lot of people are still struggling to pay their hospital
Well, why
bills.
can't government also say that there are so many people struggling to pay for their medical expenses? So PhilHealth, I will not
Yes.
take this excess funds of yours, and why don't you fix the case rate?
And
Or
I would
fix the
think,
premium.
that's why I think PhilHealth is really a failure, you know, in the implementation of the UHC, because the intent of the law is really, really to ease the burden on every Filipino. That's why I really feel bad. I really feel sad hearing about or frustrated or even mad when I see hospital bills that PhilHealth only takes care of about 12%, 8% of the bill. That is not the intent of the law. No, the intent of the law is to ease the burden. Dapat ang PhilHealth nandun.
What is easing the burden, sir? What is a percentage for you that actually eases the burden?
At least 30, 40, even 50%. And for indigents, PWs and senior citizens, our
100%.
intent, they turn on a zero balance billing, meaning that they don't have to pay anything because they cannot. They don't have the capacity.
How many years do you still have as senator? Meron pa po
I
kayong
still have
apat.
about 3.5 years.
3.5.
Yes. That's why I
Please
guess
do your best, sir.
I will. And I think, you know, Pinky, when I was able to go back to the Senate, my victory was short of a miracle, I would say, because I was independent. I was independent, out of funds. You know, I have my brother running alongside with me, but I guess there's a purpose of me being there. I think it's to fulfill my goal of having the UHC really work, no? And that's one of my intent really, is to make sure that it works. That's why I will convene I will call for the oversight committee on the universal healthcare law after 4 years at least, and where it went wrong, no?
That
Sino
would
ba
be nice,
nagkulang?
sir. Tsaka,
Si PhilHealth,
maraming
DOH,
manonood,
staff?
marami ding manonood niyan, hindi
Yes.
ba? I mean, it's a lot of the hearings, of course, in the Senate and the House could be interesting to some people and others, but this is a universal healthcare law. We want to know our rights as well.
But you know, Pinky, given its faults or flaws, no, PhilHealth, UHC, yung ano natin, yung out-of-pocket expense based on survey, prior to its passage is almost 70%, meaning that every Filipino still shoulders about 70% of their hospital bills or medical bills. Yung 30% before, kay mayor, kay congressman, kay PCSO, kay PAGCOR, or whatever. So, 70%. But with the passage of the UHC, nag-improve na yun to almost 45% eh. So, may improvement na. But now, really recently, I am quite surprised why PhilHealth parang tinitipid nila, no? Anong purpose nila? 100,000 yung bill, bakit gusto nyo 12,000 lang? And you will say that it's case rates. They should have adjusted this long before. As I mentioned, Pinky, when we are, yung orientation, they are not a private corporation na dapat magmalaki natin yung savings natin or profit at the end of the year. You're a failure. Dapat pag government ka, when you're in government, whatever funds you have for public service, dapat yan inuubos natin. No? When people are still lining up to get assistance, when people are still having difficulties paying their hospital bills, buying their medicines, you are not successful. And I think they really failed on this aspect.
And I hope you keep reminding them that, sir. I want to move very quickly to the DND cut. There was a cut of, I believe, 10 billion pesos. And then in the law, due to the AFP Modernization Act, government should be allotting about, is it correct, sir, 75 billion pesos
year,
annually. What happened, sir? Bakit natanggalan ng 10 billion?
Well, you know, Pinky, yung AFP modernization, there's Horizon 1, 2, and 3. Ito yung phases, no? By now, 2023 should be Horizon 3 already, focusing on external defense now. No? Because of the West Philippine Sea issue, no? The precarious situation, dapat Horizon 3 na tayo. Acquisition of multi-role fighter jets, missile systems, frigates, yung talagang external defense. Wala na yung internal eh. I think that has been controlled. But unfortunately, through the years or decades, yung AFP modernization ever since its package, when it, nandun yun, nakaprepare sa National Expenditure Program, goes to the House, no? and then sabihin nila na wala namang threat, whatever, it will be slashed. Goes to the Senate, slash yung budget. So that probably explains, Pinky, why there is considerable delay na. Hindi consider, talagang delayed na. Nasa Horizon 1 pa nga tayo and 2 when we should be on the Horizon 3 already. As a result of the budget cuts that is happening every year. And Pinky, I am strongly supporting the AFP modernization. You know, I've been very vocal against what China is doing. Ironic, no? I studied in the Chinese school, but it's not the Chinese people, it's the government's policy of expansionism. We have to protect our territorial waters, our rights, our EEZ, our sovereignty, and we do not have the intention of matching China, its military might. No, they are a superpower. We're only third world country, but we have to put up that minimum credible defense posture, at least yung respetado. So I've been supporting ever since I got back to the Senate. I've been pushing for. When I went back there, we were able to restore, we were able to augment, no? Kaya nga nag-improve yung Coast Guard, Navy was able to acquire vessels. But now, cut na naman, but I'm hoping that it will be restored.
But
and
was it
even
cut by
augmented.
the House? Pagdating po sa Senado, na-cut na ng 10 billion?
Usually, from sa NEP, nandun po yun, and then from the House,
So
goes to the
pagdating sa
Senate,
inyo, nagkaroon na ng minus 10
yes.
billion.
So I'm pushing for that to be restored. Again, yung intention natin, really, we need to improve our external defense to serve as a deterrent. Again, yung minimum credible defense posture na respetable. Na hindi
Minimum
naman tayo
credible
binabastos
defense.
na binubuli lang naman.
I wish we had more time because infra is also very much on your agenda.
Yes.
Senator, I hope we have a part 2. But
Yes,
we're gonna have to
anytime.
go. Maraming salamat po sa inyo. I didn't go to the light part of Senator JV Ejercito. We'll talk about that another time. Thank you, sir. Good to see you. And that's On Point. Join us again tomorrow, 7:30 p.m. here on BNC, the Bilyonaryo News Channel. I'm Pinky Webb. Thank you for watching.